is Bev. I'm a PT over at Helen Graham Cancer Center. At any point, if you have questions, feel free to ask. I don't have a problem with that. My focus is helping you understand why you have it. What are some things you can do to help manage it? You can go ahead. The relationship between the certain chemo drugs that may cause it, the how and why of those symptoms, common strategies to improve your symptoms and reduce your risk of injury, because when you can't feel your feet, a whole lot more likely to fall. And understand the role that either OT or PT could play in your survivorship phase of life. Okay, so it's a condition that has caused a change in the nerves. We don't exactly know 100% if it's the blood vessels that go. There's a ton of research. I was on the National Institute of Health today. There's like over 1,000 studies just on neuropathy, like in progress at the moment. It damages the peripheral nerves, and those are the nerves that come off of your spinal cord. Most people think of the toes and the fingertips. The numbers vary. 30 to 68% of cancer patients have some sort of neuropathy. Sometimes it starts right with chemo, starts to get worse as you build up. There's also some drugs that cause it to coast, so you may not start to feel it until you've finished your chemo. And it's hard to specifically say what the percentage is, because think about how many different kinds of cancer there are and how many different drugs there are to treat it. So that's all one of the reasons it's so challenging to manage. It is the second most common side effect. The first one being like your altered white blood cell counts and those things, the stuff they test before they give you the next round. So there we talked about the central nervous system and the peripheral nervous system. Fortunately, the peripheral nervous system can heal. We're getting a little bit of results with the central nervous system, but we definitely know we can usually often heal the peripheral nervous system. Switch. That being said, unfortunately, there is still a population of people that will have residual symptoms long term. The nerves, what the heck do they do? So we've got nerves that are motor. They tell our body what to do, the muscles, the organs. We have sensory nerves that take in our surroundings. What do my shoes feel like? Are my shoes pinching? Did I step on something? Our eyes telling us what we're seeing. We also have autonomic, and those are those automatic ones we don't think about at all. It's that fight or flight. Okay, somebody just walked into the room with a machete. What do? That's your autonomic system. But it does play a role when neuropathy comes in. So we'll talk about that a little bit more. So the body is sensing what's happening, sending it to the brain. So even that nerve, if it's damaged, it may be sending the wrong signal. We'll talk about that a little bit too. And then your brain's got to process all that information. That brain that now has chemo brain on it. So there's a lot of places where the system can get caught up. And then responding. So those nerves may not respond as quickly to help your ankle adjust on an unlevel surface because the nerves have been damaged. So you can see how through this whole process, you could have impact all the way along the whole line. All right, so people have numbness, they have tingling, they have pain. So like the way I like to think about this is if there's numbness is actually the absence of sensation. So the wires like cut, okay? Or it's sending inappropriate signals. When we used to have the TV and the waves would go like this, and your mom would say, you'd help the kids adjust their ears and stuff. It's that distorted signal. Sometimes that could be the tingling. And then there's a very bad distorted thing. The brain is not understanding what the message is coming through. So I don't know if anybody here has had the experience of the sheets hurting their feet or sneaker, any kind of shoe hurting their feet. It's not that the shoes are actually hurting your feet. The brain doesn't understand the message it's sending. So it's saying, you know what, I don't know what you're telling me. So I'm just going to tell you you're in pain. So you stop doing whatever it is you're doing. Okay. I've actually had goals for patients to wear work appropriate shoes to work because they couldn't get in anything but slippers. So it can be a really big deal. This was on the handout we gave. These are the types of drugs that are most commonly associated with the neuropathy symptoms. Again, the timing can be different with different meds. Um, and when they resolve can be different too. All right, so how the heck do I know you have chemo-induced peripheral neuropathy? Well, most commonly it's symmetrical, so it's on both sides, both hands, both feet. It can go up to the knees, and that's usually how we know. It's usually more sensory than motor. If it's really severe, then you might start losing some movement and things. So we do see that. Occasionally I'll see some foot drop come in where people are dragging their toes, and no matter how much we strengthen them, it's not coming back. So that would be a motor symptom, a motor nerve has been involved. We know that you didn't have it beforehand and you have it after chemo. So that makes me think, okay, it's probably chemo-induced peripheral neuropathy. The symptoms are worse distally, tips of the toes and the fingertips. And that's usually the things that people will tell me the most. And it gets worse as you continue with the chemo. And it's not uncommon that they stop it because you have such bad symptoms that you can't tolerate it. So they have to do a dose reduction or stop. So that's how we kind of rule it out to know. Now, if you had numbness and tingling in your hands beforehand, that's going to just complicate, or numbness and tingling in one leg. I'll get people that have it worse on one side because they had a back injury and had tingling there beforehand. Or if they had carpal tunnel and they have tingling, it's going to make those symptoms worse. And it's going to be harder to treat because you already had pre-existing symptoms. Yep. Okay. Symptoms. I've heard every description possible, from I feel like I'm walking on Legos to I feel like I'm walking with my feet on fire. They're all correct. Everybody's interpretation is different. And if I know what that symptom is, we can try to address it. So the pins and needles, numbness and tingling. Some people say their socks feel like they're all bunched up. Pain or hypersensitivity. Sheets hurt, sharp shooting pain. That's a real challenge when you get that sharp shooting stuff. Is that you?
Yeah.
Your specialty? All right.
Yeah, you did.
Well, he stopped at the sixth session because I said, "Oh, gee, I'm not feeling my fingers." He backed off the dose because I wanted 7, but as it turns out, the Provecto is better than the chemo. It's going to replace it as number 1.
Good.
That's
That's
where
great.
radiation goes in your veins.
Oh, I don't even know about that.
Yeah, look it up. They're advertising it on TV now.
Okay. Sensitivity to cold and heat. I know when you take stuff out of the refrigerator, how bad it hurts. Going outside, especially this time of year, you're not used to it, and it's coming back, and you can't get your toes warm again.
A lot of cold. We were just near Albany, New York, and it was very cold.
Well, 81 here, frost up there, 30.
They were
That's
frost
good.
all over.
Sometimes people will start to say they're having trouble using their fingers, whether it's buttoning, tying shoes, picking up pills. Those things can be really challenging. Their balance is off, especially if you're in a crowd. Just think about it. Your brain's trying to process everything that's going on, and you have to maneuver through that. Making turns, walking into the dark, going from your car to the house at night, walking through the parking lot at a restaurant. You don't have that visual input that you usually have. So one of your systems is now taken out, and you're depending on that sensation so much more. Hearing loss, I don't have too many patients with that, but it does happen with certain meds. So if you started to feel that, you definitely need to let your doctors know. Itching, coldness, burning. There's so many different symptoms. Do those make sense to you guys? They're pretty common. Okay. Now the motor ones, we talked about this a little bit. Their foot slaps when they walk, or they catch their toes because they can't pull them up. That's when it's gotten to the point where it's affecting those motor nerves. And some of the drugs will affect motor more than sensory. Just depends. I actually have a grid in my desk that tells me which symptoms are most likely with which med. But there's so many of them, I can't possibly remember them off the top of my head. But they all have specific tendencies. Opening jars. Difficulty going up steps, ramps, curbs. Like those are all questions I ask my patients. Do you have any trouble walking on grass? Sometimes we go outside and find grass. We practice on hills, you know, because some people, they just don't feel comfortable with it. If we don't train it and practice it, you can lose that skill. Muscle cramps, oh, big one. And there's not a ton that really helps with it. We can give you the most potassium possible, and people still get cramps, unfortunately. Decreased reflexes when they do a little hammer on your elbow or your ankle or your knee. Furniture walking. If you find yourself reaching for stuff, you probably need a cane or something. You know, furniture is not meant for that. And we want to reduce your risk of falls. Decreased muscle size just from those motor nerves being affected, and fatigue. Fatigue is such a big deal. We'll talk about that in 2 weeks in the lecture series. So those autonomic ones, these are the really hard ones, especially with the breast cancer patients, because we don't know if it's neuropathy or is it the medications that you're taking, okay? One of my patients referred to tamoxifen as toxafen, because that's about what it is, seems like. Lightheadedness, your blood pressure and your heart rate can be lower because of the chemo affecting the nerves that feed your lungs and your blood vessels and your heart and all of that. Heat intolerance, ever feel like you're just going to melt when you go outside? Sometimes that can really get bad with some patients. Increased sweating, even nausea, bloating, and cramping could be from autonomic stuff that have damaged those nerves. And urinary and bowel problems. So if you have the urinary and the bowel problems, we also have pelvic floor therapists that help with those types of symptoms and help you with strategies to improve that function. It's not me. I definitely don't know that stuff. Was not interested.
Yeah.
You're next to me. So you're gonna answer those questions. I'm like, oh, if you're having trouble, tell me what it is. Okay, I'm gonna have you see Emily or Randy.
Yeah.
But I know how to identify the problem and just send you to the right person. Okay. So management. I wish I could give you better answers. Some of the prescription meds that they use are from traditional nerve pain with the pain clinics and things like that. It may be Lyrica or gabapentin. The research only supports duloxetine for medication management. That has modest support in the research. So it could have poor support or it could have really high. It's about a modest support. It works best when you have pain. Doesn't really help numbness and tingling. The doctors want to do something to help you. So they'll try to prescribe a medication, but sometimes like even the gabapentin can make people more unsteady. And it may not necessarily even change their symptoms at all. There's new research out for capsaicin. So that's like the hot peppers. It's patches that you put on your feet that are super, super strong. To me, it just changes the signal to the brain to kind of scramble things up. Over-the-counter medications. Oftentimes they'll recommend B vitamins to help with nerve health. They're safe, so it's a good thing to try. One of the other things that the research has shown is that your vitamin D levels are very important. So oftentimes when I have patients come to me, I'll ask them, have you had your vitamin D checked? And if they haven't, I'll ask them to talk to their primary care or their oncologist, because low levels can predispose you to that. And that's only come out in like the last year. Anything that you take, you need to clear by your oncologist, because it could impact either your maintenance treatments or your chemo treatments. Okay. There's really no strong clinical evidence that supports any supplements. So these ones you see on TV, there's no research behind them. You know, is it going to hurt you? Probably not. But is it really going to help you? The research says not really. There's no medication that's going to reverse the damage, unfortunately. I wish I had something to tell you. There's so much research going on to how do we prevent it? How do we treat it? Biomarkers, what can we look for if we take blood from you to know that you're more likely to develop neuropathy? And that's some of the big research that's out there, is looking at those biomarkers. I'm sure we'll get something in time, but again, think about how many different chemotherapy agents, how many different kinds of cancer there are. You're like trying to solve a problem that's like 5,000 problems. So they're trying, it's just really hard. Controlling your pre-existing conditions. You guys have probably heard of diabetic neuropathy. So if your blood sugar isn't controlled, it's going to make the neuropathy worse. If you have vascular disease, like poor blood flow in your legs, that's going to make it worse also. So we have to work with those vascular doctors to figure out what is it that you need to help improve that blood flow. Radiculopathy, that's that back pain. So if you have nerve impingement somewhere along the line, that could make it worse. So we want to try and address those things to at least turn the volume down somewhat if we can. That's medication management. We'll switch to the next one. There's also some research right now. I think it's at Penn. They're using CBD oil. So I just looked at those studies. We don't have many. There's like 3 studies going on in Baltimore for duloxetine and electrical stim therapy. There's just like a historical, I guess, getting information on how patients have progressed so they can understand the process. And at Penn, there's also that one about the CBD. So there is research out there. Christiana just finished a study with electrical stim. I haven't seen the results yet, so I'm curious to see how that came out. But there's other things you can do. Self-management. You have to care for the body you're in. These ladies we were talking, the doctor saved lives, but they don't tell you how to live in the body you're left with afterwards. And it's a different body. And a lot of it is taking care of all of you. Okay. So thinking about movement, what can I do to move around and exercise that's safe for me? Attitude awareness. You've been through a heck of a lot. I tell my patients, nobody ever taught us how to have cancer. And there are counselors out there available at the cancer center. They only work with cancer patients, so they understand that specific situation. They help ask the right questions, help you get your mindset where it needs to be. Simplify demands. Do you really have to do that? Do you have to do that today, or could it wait till tomorrow? You know, why do you have to be the one to clean out the gutters and climb up the ladder and you can't feel your feet? Really? There's other people you can pay to do that, or something. We have to find another strategy. Okay. So making choices about the safest things to do. Environmental changes. We'll talk a little bit about falls and things like that. But there's other things. Exercise. Exercise has the highest research to support that it improves neuropathy. And it also reduces falls. So I think we're going to talk a little bit more about that. But mindfulness. I'm sure you guys have done mindfulness programs here. You have yoga here. We'll talk a little bit about more PT, but environmental planning. Using different tools and techniques to make it easier in your everyday life. And sometimes therapy is really helpful for that, as well as the people in this group, in this program, at the cancer support community. Hey, I have this problem. What did you do? Sometimes they have more knowledge than we do. Patients come to me with new stuff all the time. Ooh, I like that. I can take a picture of it, you know, so that I can share it with my patients. So exercise, it protects. So if you're starting chemo and you start an exercise program, it actually helps protect the nerves from developing neuropathy. Some of you know, this is my mom. She came with me today. She had an exercise program before she even started chemo. The day we found out about it, I started her on exercises. So I practice what I preach. Absolutely. I gave her all the things that we talk about today. She has most of those. It can help the nerve recover after the chemo. Think about how much blood flow you're bringing throughout your body when you're exercising. Structured programs are really important. They need to include cardiovascular, strengthening, and balance. Balance training is super, super important. There's very few side effects, you know, and unless you have some medical condition that contraindicates it, exercise is very well tolerated. And the amount of exercise you need is not a no pain, no gain situation. We're not talking about that. So if you have concerns about exercising or other medical conditions, that's when it's an appropriate time to come to therapy, because they can set you up on a program that's specific to your needs. Um, I just said that, no pain, no gain, right? You gotta listen to your body. Slow and steady wins the race, right? So if you do an exercise, I do an exercise with you in the clinic, come back and say, oh, that really hurt. Well, obviously I'm not gonna send it home with you to do it home. So I tell my patients, if I didn't give you a picture, don't do it. Same thing for yourself. If you're doing something and it causes pain, stop. Make sure you're doing it properly. There's all kinds of factors. Accountability partner, we talked about that earlier. The walking warriors, this is why I send my patients here. Chair yoga, Tai Chi. Well, where were you? Why didn't you come? Because you know you're going to have to go because Susie's going to ask you or give you a really hard time. Or you want to hear what Susie's granddaughter did because you talked about it the week before. Now you need to know what happened. So I like to encourage my patients to participate in community exercise because they're more likely to continue than if you just give them an exercise program to do at home. Avoid exhaustion. That is your body telling you you did too much. Okay. So if you did it, that happened, think about what you did that day and how can you change that? I also tell my patients, if you have a big event, you need to rest the day before, go to that event. Say it's a wedding. But guess what? You better plan that you're going to be exhausted the next day or two. But you go have fun on that wedding day. You just plan around it. Okay. Plan what you need to do to avoid that exhaustion. Always, if you're on any kind of hormone therapy, you've had surgery, you've had radiations, those are precautions to exercise. You can ask your doctor if it's safe for you. And if you're more uncomfortable and you want to get more specifics, that's where therapy can help guide you. And it doesn't have to be 8 weeks of therapy. It could be a couple visits, get you set up on a program, and then you go back out on your own. Exercise strategies. Start slow. 5 to 10 minutes of walking 2 or 3 times a day. It could be, oh, I've never walked. I don't walk. Okay, walk from here, walk 2 or 3 houses and come back. Then walk 5 houses and come back. Walk to the end of the block and come back. So you always want to make sure you know you're going to have the energy to get back. That's a big issue. Track your steps. A lot of people these days are wearing Apple Watches or Fitbits. The newer Apple Watches have fall detection on them, which I love. We bought one for my mom in Florida, and she uses it all the time. And just increase slowly. It doesn't have to be 90 miles an hour from the get-go. Non-weight bearing exercises, so cycling is always good. Swimming, if it hurts your feet too much to go for walking, those are other alternatives that could make it more tolerable. All right, sensory diet. This is my favorite. It's on the back of the colored paper. So these are things that I do with my patients. Very, very simple strategies. Doesn't really require a lot of stuff. The way that it works is you want to get 20 minutes of sensory exercise in a day, but you want to break it down into 2 or 3 minute sessions. Okay, I'm gonna tell you crazy stuff because you'll remember if I tell you. Practice sensation, exercise the nerves. So take your socks and shoes off, rub your feet on the rug. Before you get out of bed in the morning and when you go to bed at night, rub it on the sheets. Rub your hands and your feet on the sheet. What does it feel like? Is it smooth? Is it rough? Is it hot? Is it cold? Your texture of your blanket on top is going to be different. Rub your feet on it. Okay. Sitting on the toilet. See, I told you I'm going to tell you crazy stuff. Sit on the toilet. Is there a rug there? Rub your feet in it. Flip the rug up. What's underneath of it? Is it linoleum? Probably has a texture. If it's tile, can you feel that it's cold and smooth? Can you feel where the grout lines are? If it's wood, can you feel where the wood meets? Okay. Your couch has a different texture. Maybe your recliner has a different texture. You're just incorporating that in. Standing at the kitchen sink, if you have a rug in front, take your slipper off, rub the rug. Does it feel the same on the tips of your toes as it does on the ball of your foot? Does it feel the same on your heel? Okay, because it may be very different in all of those places. I've had patients come back to me and say, oh, I felt the sheets on my toes today. It's the first time because they normally felt nothing and they get very excited. I had a patient say, I felt the sandpaper of the bottom of the pool. This was a patient who literally taped her flip-flops on because they were more fashionable than other shoes. So it was, sometimes you get crazy stuff. But finding those textures throughout the day, either hands or feet. Okay. Desensitization activities. So if you know that your feet hurt when you get in and out of bed, the sheets touching, gradually start to get used to it. Try 5 minutes wearing those pair of shoes you can't wear, and then maybe 6 or 7 minutes, but practicing those things that are challenging and thinking. You have to think while you do it because you're trying to connect that brain to that nerve, right? Remember how sensory information comes in and then they send more messages out? You're telling that brain that does not hurt. There is no reason that hurts. You could rub it, like rub the top sheet on your foot and then rub it up here. It feels the same. So you have to retrain that brain to understand what it's feeling. So there's a little vibration tool. You can get those on Amazon. And people love to do that on their fingertips. Okay, that's really good for that. If you have a partner that could do it on your feet, that's great. They make a big foot plate that you can put on there. Yeah, it looks like this. It's got little nubbies and it vibrates. So that's a really good thing for sensory input. A golf ball, dog ball, lacrosse ball, whatever ball you can find. I have a Boy Scout that digs them out of the creek for me and I wash them and bring them to work. So whatever you can find, roll your foot on it. It stretches that foot. Does it feel the same at the tips of your toes? Does it feel the same at the arch? Does it feel the same at the balls? Does it feel the same at the heel? So really thinking about each of those steps. When you get out of the shower, you got to dry your feet anyway, right?
Does heat have any effect? Which is better, heat or cold, if you're having pulsation?
It's individual, but the biggest concern with ice and heat is that you may not feel that you're burning yourself or that you're getting frostbite.
Oh,
So that's a big challenge. You
if you
have to.
smell the skin, you went too far.
That
Dear.
would be bad. That would be really bad. But I can't necessarily answer it. You got to make sure it's not too hot. And some people it feels better and some people it does nothing.
Okay.
Okay. Maybe really warm socks might help.
Yeah.
Okay. But when
I used initially the long stretch socks.
Mhm.
That helped the sensation in the ankle.
There is research going on that compression during chemo or after chemo helps improve the symptoms. So that is another option, compression socks. And you can buy over-the-counter compression socks that are totally fine. Like nurses wear them every day. I think I have compression hose on right now. But if I'm going to be up and moving around a lot, I just tend to like them. But when you get out of the shower, you got to dry your feet anyway. Another texture, right? What's it feel like on the top of your foot? What's it feel like on the tips of your toes? The ball of the foot. I'm saying the same thing over and over again, aren't I? So the arch, the heel, notice that it's different. Marbles. I'll give my patients marbles to pick up with their toes, drives them crazy. They get so mad.
Totally crazy.
And sometimes they can't even find the marble, but let me tell you, I send them home and they come back like, I did them. I got them all. I can feel them all. Sometimes they can't even move their toes. And this is a way of getting them to start waking things up and moving the toes. Shower or water bath. If you have a foot water bath at home, that's great. Don't go buy one, but if you have one, great. You could use that. If you have a back brush, try that with your feet, but sit down and do it. If you have a shower chair, sit down and do it, or do it outside the shower. Don't stand on one leg in the shower if you're going to fall. Okay. Safety first. Let's switch to the next one. Couple other things I like to talk about is, with picking up stuff with your fingers. I'll oftentimes give patients a bottle, or usually it's a Ziploc bag. Actually, honestly, it's not a Ziploc bag. It's usually a glove with a tie at the top. And then they go home and put it in a Ziploc bag. Picking up dry beans or coins, anything small to practice picking stuff up. Feeling the texture of different things with your hands. I had one patient, she had more neuropathy on one hand than the other. So she checked the blueberries with her bad hand and then confirm it with the stronger hand. There is a groundhog, or I guess it's a groundhog. Yeah.
Is it listening?
They're probably, he keeps coming and going in my line of sight.
They're telling you
You're out there.
Probably usually around too.
Hey, it must be a nice place to live, right?
Yeah.
So there's more ideas on your sheet, but they're everyday things that you can easily get. So safety. You want to make sure that you're safe in your activities of daily living, because we don't want falls. Falls can be disastrous. You can hit your head, you can hit your hip, you could break an arm. We don't want falls. We want to make sure we try to prevent that. We talked about not being able to detect temperature. So if you stick your hand in the shower, what are the chances you're going to know it's too hot? Use your elbow. Stick your elbow in, okay? Or you're like higher up on your leg to make sure when you check it. But you make sure you're checking it somewhere that you have good sensation. Careful in the kitchen, you don't want to get burns, okay? Because remember, if those nerves are impacted, it's going to take longer for things to heal. So you want to avoid those injuries. So gloves, pot holders, gloves when you're using sharp utensils, screwdrivers, how many times have the screwdriver slid off, and you know how it works. Yard work, being very careful, especially if you've had lymph nodes removed. You don't want to get cuts and scratches because it increases your risk of lymphedema, right? So make sure you're covering up if you've had that, especially. Handrails, use them for safety. If you can't feel your feet, you probably need to not be driving. That's a really, really important thing. My father-in-law had to give up driving eventually because his feet were so bad he couldn't feel the pedals anymore. So it happens. And you got to be aware of those kinds of things for your safety and everyone else's safety. If you're lightheaded when you stand up, a couple of things, pump your ankles. If it's consistently a problem, compression socks can be helpful. Stand up slowly. Take that little check once you stand up. All right, everything good? We working? No problems? Okay, now let's go. Stay hydrated. If you don't have enough water in your body, it decreases your blood volume, and then you're more likely to get lightheaded. I'm hoping we have a slide about shoes. Let's switch to the next. Yep, there we are. Make sure you're wearing appropriate footwear in and out of the house. If you have decreased sensation on your feet, you should never be walking around barefoot or in socks. You always need some kind of shoe on your foot. Best is something with a hard surface, so that if you step on something, it doesn't come through the slipper. And also make sure it's got a back on it. Those granny flip-flop slippers, no. I've seen patients walk right out of their shoes in the clinic because they're wearing shoes that don't have backs on them.
I don't even know it.
They have no clue. But think about it, if you stepped on it, it's half on, half off. Could you fall? Super easy. Okay. Skin checks. I did have a handout on protecting your skin if you don't have good sensation. You can use a hand mirror. Okay, simple hand mirror to check the bottoms of your feet. You're looking for red spots. You're looking for cuts. You're looking for scratches, because it's going to be much harder to heal something if you don't have the appropriate blood flow possibly and nerve recovery. The nerves aren't functioning as well as they should. So you want to really protect those. Keep the skin moisturized and healthy. This is your first line of defense. Your skin is an organ. If it's dry and cracking, you could get an open sore. Then you're at risk for infection. So really take care of those hands and feet. Make sure they're lotioned. If they're dry and flaky, get some lotion on them. Okay. Next, adapting your home. Every 14 seconds, an older person is treated for a fall in the ER. Falls are way too common. If you have had more than 2 falls in a year, you probably need therapy. So putting that out there, it's super, super important. You might need to change things around to make it safer. Rugs, really easy to trip on the edge of a rug, catching on your shoe, or you don't see it and it's rolled up. Okay. Cords in the way. Not adequate lighting when you get up to go to the bathroom at night. So simple things like that can really help. And correct any safety issues. No climbing up on multi-step stools, try to keep the stuff you use on a regular basis close to you so that you don't have to climb. Okay. Go ahead, switch. These are pretty common. Make sure that you have handrails when you get in and out of your house so that you have something to hold on to. Adequate lighting. Light switches are available when you know where they are and you can get to them in a reasonable amount of time so that you're not in the dark. Are your handrails steady? Okay. The handrail is not going to hold you if you fall and it comes right out of the wall. Okay. Anything that's broken or uneven, torn carpet, cracks in the sidewalk, you've got to be extra cautious around those kinds of things. I'm just going to highlight a few of these thresholds. They can get really challenging. So make sure you're aware of the thresholds that go from room to room. We talked about the oven mitts. I think we talked about a lot of these already. Let's switch to the next one. In the bedroom and bathroom, again, make sure you have lights. Have grab bars if your balance is that bad. You may need a grab bar outside the tub and inside the tub. Use a seat if necessary. You don't want to fall in the shower. Okay. Making sure you keep your cell phone with you or the house phone. You need to have accessibility to a phone if you're at risk for falls. There's nothing worse than falling and not being able to call for help. You know, I had one patient on the floor for over 12 hours. And it was really important to me that she knew how to get up and down off the floor. So try to practice that skill. If you don't use it, you lose it. So if you can still get up and down off the floor, keep practicing it. Get down, clean something, get back up. Because again, you forget how to do these things. I remember my grandmother, she had a stroke and she forgot how to get out of the bathtub. That was fun trying to get her out of the bathtub. So you don't want to stop doing these things. If you need a raised toilet, those things are available. Go ahead. So PT, OT. Our OTs tend to be more on the activities of daily living. I'm having trouble in the kitchen. I'm having trouble dressing. I'm having trouble bathing. If it's a minor thing, the PTs will just help you with it. But if it's something more or you have quite significant neuropathy in your hands and your feet, sometimes we'll split it up and they'll do hands and we'll do feet, because I may also be dealing with cancer-related fatigue. So we'll be talking about different strategies. OT also talks about strategies, prioritizing your tasks for the day. Are you a morning person? Or do you need a nap in the afternoon? What is your sleep like? You know, those are all important factors. Again, if you furniture walk, you might need some kind of assistive device. Your PTs can help you with that. Pain management strategies, talking about different things we can do to try and improve your symptoms. And a lot of that is through exercise too. We talked about a lot of sensory desensitization activities and sensory reeducation. We do a lot of that in PT. And safely get you into exercise if you have a cardiac condition or if you have a respiratory condition, you just don't feel comfortable. We can come in and we can help you with that. Oftentimes that cancer-related fatigue and the neuropathy go hand in hand. And for God's sakes, if you've been through chemo, you're probably weak. You know, you might need a little bit of strengthening. And just like our older cars, as we get a little older, we need a little more maintenance on a regular basis. I'm not really happy about that because you hit that 50 mark and things start falling apart even more. And I got to exercise more. But we're here for you. We only work with cancer patients at Helen Graham. That's all we do. We know the precautions. We know the risk factors. If you have bone mets, we know the precautions to take. And we're just a phone call away. We are starting to see some patients at other locations.
Mm-hmm.
I've been out of the office for a couple weeks.
Yeah, we have one therapist who is at our Concord office right there on 202 heading into the Pennsylvania line. She's just rough right now. We had to pull someone back.
Yeah, it's hard to find cancer therapists, really hard. So we're trying to spread those services out, but fortunately Christiana's site is pretty central. And if we know that someone's traveling a long distance, we try and modify things so they don't have to come as often and give a lot more of a home program. Our next slide. We talked about most of that. Yeah, we have all kinds of other stuff. I do remember, I did not talk about smoking and alcohol with neuropathy. Both smoking and alcohol are known to make symptoms worse. Not saying you can't have a glass of wine, just need to know, does that happen to you? Does it respond? Does that happen? Smoking is 100%, we know it decreases the blood flow in small vessels. So that's really going to contribute. We have a nurse navigator that hopefully you guys have met if you've gone through Christiana. They help guide you through your care, answer questions, find the right people. Social workers help with transportation, financial needs. There is a smoking cessation program. We talked about behavioral health. We have nutritionists just in oncology. We went and saw the nutritionist before we even started chemo so that we could understand what we needed. They were very, very helpful. Palliative care and pain management. Sometimes if we can't get that neuropathy under control, they may have some strategies or things like bone pain from metastasis. They are amazing at that. So that's a great place to reach out to. Safe Steps program and home care services. There are times that patients come into me to see me an outpatient, and I can tell they're not safe at home. There's stuff that's happening at home, and I tell them I need you to go through home therapy first because I need to make sure you're safe there and then come and see me. So the Safe Steps program is like a fall prevention program they do through Christiana Care. So there's lots of resources out there for you. And that's just some citations. There is, if you're into, acupuncture has quite a bit of support behind it in the research. It's still early on, but if you go to the National Institute of Health Complementary Medicine, they have all the research on vitamins, on acupuncture, on Reiki, mindfulness, yoga. Like there's tons of research out there, and you can find it right on their National Institute of Health. All right, guys, you got a list?
And if you're on the Zoom, you can either unmute to ask the question or feel free to put it in the chat and I'll be happy to ask it.
Can I ask you something? So if you said if you fell more than twice in a year, get therapy, that would be physical therapy. And that would be
Yes.
for like balance pretty much.
Well, you would need an evaluation so we could determine what we think is going on. Is it a strength issue? Is it a straight balance issue? Is there something more going on? And that's what we would look at in an eval. Do you need an assistive device? You know, those are the kinds of things we would evaluate.
But who are you talking about evaluating? Because I don't go to Christiana Care.
Well, any outpatient therapy could do it. We specifically have a program that's just for oncology patients, though.
But what if you're out of your treatment for a couple of years?
You can still come to our site. That's not an issue. Once you're a cancer patient, you're pretty much a forever cancer patient, a survivor in our mind, and your needs are different than someone who's never had cancer.
So I missed the beginning, so tell me where I would connect, because I actually go to Penn, but.
You can still come to Christiana for therapy.
Okay.
That's not an issue, because Penn is really far to go, once or twice a week. That's really far. No, you can come to the Cancer Center at Helen Graham. You don't have to be doing your treatment there. And you can also, there's the site in Concord on 202, just across the state line. We're working on getting other sites up and running, but their cancer therapists are few and far between.
And in Helen Graham, you're on the
Fourth floor.
Fourth floor.
Mhm.
But it's PT within there? Like who would
Yes,
I call?
and occupational therapy. So we have both. And
Okay.
if someone were to come to me and I thought they had OT needs, I would request a referral from the doctor and we would let you know, recommend it to you. So if you needed more than PT, we could make that happen also.
And you mentioned the National Institute of Health Alternative Medicine, was it?
Yeah, or complementary medicine.
Oh,
They have a
complementary.
website. Yep. So it's
And then-
that non-traditional medicine, not pills, not surgery, but acupuncture, supplements. It tells you what the research is for each of those things.
And one more thing. You mentioned some sort of like stimulation for your feet. What was that?
It's still in the research stages. It's not routine care at this stage, but it is something that's in the research. Christiana just had a study that's finished. They're collecting the data and putting it all together. So I'm waiting to see what that research says, because I would love to be able to give my patients something that could give them relief.
But
And
like
we
something,
use-
go on.
use electrical stim in other portions of therapy. So it's a familiar thing to us. It's just not been applied to cancer patients at this stage.
But there was something over the counter. You said like you could buy a device or something.
Oh, a little vibration machine. It's a little handheld vibrator. And we probably can send you some
I'll
handouts.
send, yeah, I'll send Erica all of, our
Yeah.
handouts that we have, and then she'll forward it with.
When you get the recording,
Yeah.
you'll get the handouts and you'll see
Yeah.
it.
And there's a foot vibration plate in there too. And what's important with the foot vibration plate, it has to be variable frequency. Because if it's the same frequency the whole time, your brain just gets used to it and ignores it. So it kind of goes fast, and then it goes slow, and then it spreads it out a little bit. So it changes throughout the treatment.
And
Great.
that-
Thank you so much. Thank you.
Welcome.
Sorry, Judy, this is Shelby. I didn't introduce myself to all of you. Some of you here last week.
That's my
I'm also
boss.
From Helen Graham, but I did want to mention with the vibration plate too. Please do it seated, or at least start with it seated.
Oh, yeah.
Some patients grab it and they say, oh, you gotta practice it in standing, if, you know, you have poor sensation.
I've
and poor balance."
never
So-
heard that. Oh my
I
goodness.
know.
Mom, don't do that.
Yeah, start with seated.
Right.
By your therapist.
Yes.
I asked
Oh, go ahead.
television, they were explaining what happened with neuropathy in age. There are hairs or protective, once you get above 40 or 50, these protections of the nerve begin to degenerate. And they are now working on I think according to them, but they've done it, that the nerve hair or protection of the nerves is, you can get it to grow back if you do certain things.
I have not seen that or what you're talking about, but that is correct. The covering, some of the chemos attack the covering on the nerve. Some of the chemos attack what's called the mitochondria, which is like the power supply inside the cells of the nerves.
Mhm.
So that's why it's such a problem, is there's so many different things that are causing it. It's not one cause. So that's what makes it really challenging.
So with the removal of hairs, that's how the nerves, you feel the pin feeling.
Yep. It's a challenge. It's a real challenge.
So short of regenerating the nerves, which, well, that would be fabulous. I noticed that you identified the 3 chemo drugs that were all 3 were the platinum based.
Well, there's the platinum base, the taxanes, and then there's like 1 or 2 immunoglobulins that
Okay,
immunotherapies that do it.
so now for someone who has neuropathy and has never had chemo, mine was declared to be radiation induced.
Yeah, you can get that when they do radiation, if they hit the nerve, it can cause damage. I wouldn't say it's as common,
No.
but it definitely can happen. And if you didn't have any of those chemo drugs, are you diabetic?
Yeah, I know, they ran the whole gamut.
Yeah, and there are neuropathies out there, like there's idiopathic neuropathy, like they just don't know why you have it. And there's some other more severe conditions that cause neuropathy.
However, what you described as like the desensitization, all those treatments are
They can work
precisely what you would do
Yep.
for the symptoms, because you're not really treating.
You can't make it go away, but you can, my goal is to strengthen the message coming from the nerve.
Okay.
So that the brain understands it and that it's sending a good message. And a majority of my patients have improvement in their symptoms. Rarely do they get rid of it in the time that I have them, because what happens is I may have you 4 weeks, 8 weeks, 12 weeks, but it's going to take longer than that to recover. So you're sent home with a program. Basically, it's that sheet. I pick certain things for you to do, and you continue to do those over time, and the neuropathy gets better and better, or it gets to a point where it plateaus. But majority of my patients get some relief, and they're always stronger. They always have more endurance, and they always improve their balance.
So even if it is not chemically induced,
Mhm.
but it's in a cancer patient.
Even if it's not a
treatments-
cancer patient, these
Oh, I thought you
theories can
said you're
apply.
special.
It
Yeah.
can still, we specialize in cancer,
Right.
but a diabetic, I gave my father-in-law all of these same exercises to do because he had diabetic neuropathy. I said, I don't know if it's gonna make it better, but we're gonna try. It's not gonna make it worse. He was not a
What was
great
your
patient to
question?
use
Could you
that.
go to Christiana?
Right.
Yes, yes, you could because you're a cancer patient.
I have a question. Um,
Go ahead, Kim.
I heard you say, I think it was maybe 2 slides back, that there's a nurse, is it like coordinator or something like that?
Nurse navigator.
Navigator. So
Yes.
I'm still like, so I had my chemo, I finished it in July of 2024. And then I had like double mastectomy, and like next month I'm having a full hysterectomy, and I'm seeing like so many doctors, and I don't know, like, I'm also like a bariatric patient, so I'm seeing them over there. It's like I have a gazillion appointments all the time, and maybe that's okay, but I just want to know like how to like, you know, I don't know if I can cut out any, or
So
like if
so you're thinking about you may need therapy, but you don't have time to fit it in. Is
oh, is
that
that
your concern?
specific, is that coordinator specific to therapy? Is that
No, that
okay?
coordinator is usually there to coordinate with the doctors and making sure that you've got what you need. Like they call us every couple of weeks and check in to see if we have everything we need and that we've coordinated with the surgeon and the oncologist and all of those things. There's patients like you that are a little bit more complicated. They may be helpful for that with you to guide you.
So yeah.
If you were really struggling with, you weren't sure you had a ton of time to commit to therapy, but you thought you might benefit, we work around where you're at and what you're able to handle. So it may be something like you would come and see me a visit or two, we get you set up on some exercises at home, and then you come back in like 4 weeks and follow up. So that it doesn't have to be as intense as once or twice a week, especially when you're having surgeries and other things happening. But if we could give you a couple things at home that you could work on, that may help your symptoms.
You actually did. You guys actually did. I went to you, and it was really helpful. Like really, and then, I came home with the Play-Doh stuff and the marbles, and like, yeah, the marbles were challenging, but it was a great.
Yeah,
But
are you asking how to get in touch with a nurse navigator as
Yeah,
well? Do you
yeah,
have that
yeah.
coordination? So one thing you can do, I mean, we can always pull it offline. I can always get your contact information from Erica to get you in touch with a nurse navigator. But usually if you are still active with your oncologist, they should be able to set you up with your nurse navigator as well if you don't already have that connection.
Oh, okay. Yeah, I do see my oncologist, every 3 months, 6 months for tests.
Do you have an appointment coming up soon, or we're
Uh,
trying to get that?
I have one in January next.
Pretty far away. Yeah. I mean, take it offline and I can get your.
Yeah, we'll try to
contact,
get you
yeah.
connected to
Okay.
get one sooner than January.
Yeah.
Because there's different nurse navigators for different diagnoses too. So we can get that information from you later and help facilitate that for you.
Okay, that'd be great.
Yeah, we very much in our clinic are very holistic. We'll refer you out to other places because we want to take care of all of you. It's not just your feet I'm worried about. We want to kind of take care of the whole person and make this survivorship as good as it possibly can be. So sometimes that's not us. Sometimes it might be somebody else in addition to us.
Okay.
I'm expecting more questions from you. You told me you always ask questions.
Well, typically I do.
That's the answer.
Must answer us.
Yeah.
Your PowerPoint did it, Bev.
You did cover a lot.
Anybody else have any questions?
I have one more question.
Okay. Go ahead.
You kind of addressed it, but just to ask in, like I had neuropathy before my cancer treatment from an autoimmune disorder, within a year or two before that. And then I had chemo, and maybe it's really hard to know if it got worse or not. I don't quite remember, I actually have thought about going back because I had that ECG or whatever it is, measurement on your feet from a neurologist. So I've thought of going back to actually know objectively if it actually got worse at all during chemo. But like, is you're saying it's not really that different, whether it came from the autoimmune versus the cancer, you're going to treat it the same.
Yes.
Okay.
Yes. And the hope would be that it gets a little bit better. We may not be able to take it away because it was there before, but the goal is to try and get it better, or to at least strengthen the other systems so that you're less likely to fall, you have more endurance, those kinds of things.
Great. Yeah. Thank you.
And I just want to make sure I heard correctly. Did I remember what I was saying?
Would you like us to come back?
It's something, oh, I know what it is. That there really is nothing you can do about those cramps.
It's a real struggle. I mean, I teach my patients stretching consistently, making sure you're getting the micronutrients you need, like the potassium and those kinds of things,
Magnesium.
the magnesium. But
Hydration.
do you have any?
No, and I think it also depends too, what Bev kind of alluded to is that, right, there's so many different causes that could be an effect. So yes, are you hydrated? Are your nutrients correct? Are you stretching? Are you having flexibility? And even things like swelling, if people have unaddressed swelling that can create cramping. So addressing your swelling and making sure you're wearing your compression. That has been a lifesaver for certain people. For me, even if it's a mild swelling for them.
If you do come up with something, tell Eric.
We'd be done. We're be on a beach somewhere.
That's a good plan.
You can't go anywhere. You got little kids.
I know, yeah.
You had said something like vitamin D levels can predispose you to what? Is it neuropathy?
It can make the neuropathy worse and make you more susceptible to it. And it's such a simple thing to test and to supplement that I do encourage my neuropathy patients to, whether it's their oncologist or their primary care, to have their vitamin D checked, because there's a huge portion of our population that does not have adequate vitamin D.
One last question for me. My neuropathy was caused by the chemo treatments. I have it pretty much like in my fingertips, really bad. Like I can't feel anything, and both feet are worse. But I don't have pain with my neuropathy. I just feel
That's very common to not have pain.
Okay, that's what I was going to ask.
It doesn't mean it's comfortable. It's very uncomfortable, but it's not pain. They're different symptoms for everybody.
Yeah.
And unfortunately, pain is the only one that one medication helps. So if it's not pain, there's no medicine that's going to help it. But this could help it.
Yeah. Okay. Thank you.
No, I had some information. I go swimming 3 times a week at the Boys and Girls Club. And the Boys and Girls Club is very inexpensive compared to anybody else. And she does all these motions that keep you moving your elbows, your shoulders, your back, your legs. And that's a really good way to recover or even keep going.
Now, is that Frame? Is that the Frame Senior Center Boys and Girls Club?
No, it's on Route 40.
Oh, okay. Oh, I gotta know about that. That was not on my list.
Yeah,
But
so
I don't know if you guys know that Livestrong at the Y has a cancer program. The Frame Senior Center has a nice gym there. Newark Senior Center has a nice gym, and many of the other senior centers do as well. I keep a list at work, but I can't remember off the top of my head the other ones. But they're great resources to continue exercising, because I find that if my patients go into the community, they're more likely to continue exercising than if they do it at home.
And aquatics is amazing.
Aquatics is great.
Yes.
For everything that we're seeing at Hologram, it's great. Do you ever send in your patients to UD for behavioral health students? Because they have a program too.
Is that like the lifestyles, like the sleep and nutrition and?
So they have like a gym for the behavioral health students who will also help prescribe programs. So it's like a learning opportunity for them as well.
So
too.
there have been programs, there were 2 programs at UD, and I thought at least one of them had been suspended, so we should
Yeah, we
update.
should update. I had a patient about 6 months ago said she was still going to that.
Okay.
So we should check.
Yeah,
into
they
that.
had a
Sounds like
personal
an
trainer at a
opportunity.
gym and they
Yeah.
would set you up in a program, and then another group was doing like healthy eating and diet, good sleep, hygiene, and mental health strategies. Like that was like I don't know, like a 6 or 10 week program that they would run, but I'm not sure that it's still in place.
I know a lot of those closed down during COVID,
Yeah.
the community outreach.
Yeah,
Yeah.
and that's kind of what we struggle with. But I've been trying to find the senior centers and things too for more cost effective options for folks. If they don't have a Y or they don't want to go to the Y or whatever.
Well,
There's lots of resources.
you
Lots-
investigated
Lots
that
of free stuff
the
here.
Boys and
Yeah.
Girls Club are less expensive,
Oh, yes.
so,
That,
I mean, that's.
especially when you're older.
Yeah, and
Especially when you're
don't forget
old.
the programs you have right here also, the chair yoga, the Tai Chi, right?
Yeah, walking, gentle yoga.
Yes.
And we do a group health coaching program, which we'll do again.
That's what it was
beginning
called,
of
it's health
next year.
coaching.
Yeah, and it's with someone who trained as a health coach at UD, so
Okay.
it follows that same kind of program.
And there's room for a pool area.
Well, I was gonna say,
Next to that groundhog out there.
if someone here wants to give a big donation. You know,
Might need some galas or some fundraising, right?
yeah, oh my goodness.
I have a question because it's recent, and that's why I'm coming up quickly at this time. Both of my wrists swell. They hurt. I could not grab things, I couldn't put pressure on it. 2 years ago, before I had started all this with cancer, I've had it since 2007, but this was intense now. I went to a bone doctor for the wrist and said, I gotta send you to, because I think it might be rheumatoid arthritis. So I went to this doctor and he injected with it, I guess it was nerve block. And it went away. Then after I completed this new Pavecto with the radiation through the left wrist, it came back. And I went to see him, and he gave me not a steroid, the other one that did. Yeah, flips my mind.
Dexamethasone?
What's Carolyn?
Oh, prednisone.
So-
Prednisone. So I had prednisone when I had the chemo, but not since. Well, it's worked. I did the final one yesterday. But now with none today and overnight, I'm starting to feel it again. Is that a combination of rheumatoid arthritis and?
I
neuropathy?
probably can't give you that answer with the limited information I have, but if it was me or my family member, I would suggest they go back to the rheumatologist. And you may need a more long-term solution. And there are options that are not as bad as taking prednisone. There are other things they can do that maybe will help manage that symptom.
Well, back with the neuropathy, I didn't have except constipation. That was the only side effect. With this one now, I had tremendous heartburn. So I didn't check back and see if that's one of
You
them.
didn't want to do it again either.
Yeah, I don't want to do it again. So I'll probably, if it continues like, that's why I wanted to sort of separate the symptoms.
Yeah, it can be
Okay.
challenging at times. Usually I don't see too much going on with the wrist. It's more the fingertips than anything.
And the ankles.
And I do hear complaints about the ankles, occasionally, but definitely the toes.
Yeah, I think that's a good point. Going
I
back.
have, I have a quick question.
Go
Is
ahead.
it possible to get the list of senior citizen places or places where they have, you said there was a paper on your desk. That's what I.
Yeah, when I get back to the office, I'm still on leave. I go back, I think the 5th or 6th. I can get that to either Shelby or to Erica.
Yeah, we'll be sure to share it.
Okay, will it be on internet? Can it be sent on internet?
Yeah.
Yes.
Yep, We'll send it in an email with the recording of this program.
And just keep in mind, things change all the time, so I think I have the contact information and what pricing information and what they have, but these things change constantly. So it's as up to date as the last time I checked.
Thank you so much. Appreciate it.
Mine was actually just a comment or a question. Last week you said neuropathy is chronic. Would you say, I'm sorry, lymphedema is chronic? Would you say that neuropathy is chronic as well? Because I have done every single thing you said. Fortunately, I've never had anything. Mine is just fingertips and toes and never had a balance issue.
Yes,
So,
it is chronic. Like I said, I think the number is about 30% of patients will continue to have it lifelong. You would be one of those ones then that I would hope with the new research, maybe you can try something. Do you get lymphedema care with us?
of course I do. I know almost everybody on the page.
Okay, so if we were to find something, then
It's layers.
we might let you know.
Yeah.
Did you fall?
No, I had lymphedema that came on 3 years after, so it wasn't there in the beginning. And to your point, you don't know what made it happen. So now this is just we're just regrouping to get it back under control, got a new sleeve, we're waiting for it. But so with the new, I've chosen to come to all of these just to hear more information.
Yep.
Because I don't like to say unfortunately, because I'm still here. So the only side effects, long-term side effects have been the neuropathy and the lymphedema.
And as I
And
said,
I'm okay with that.
earlier, I said it's the gift that keeps on giving.
But if something can be done about it.
Yeah.
To your point too, and I think we said it last week, some of these things don't show up right away, and Ben mentioned it too, so again,
Or totally after.
Yeah.
Everything was after I.
I mean,
I
it
had
can
these
unfortunately
during
be,
chemo.
sometimes I've heard people when they took a long flight or they get a cut or a scratch. I had a patient who fell down the stairs and damaged her shoulder, and that swelling set it off. And we're talking more than a decade after.
definitely. So report your symptoms, whatever you notice, report it, because the sooner you treat this, neuropathy, lymphedema, better outcomes you have to.
Yeah, I've had things that are supposed to show up in 6 to 12 weeks, and it was 22 months later.
Yeah.
Some of us just have special bodies that don't cooperate. I'm very familiar with that.
Well, thank you, everyone who's online. If there's no more questions, I'm gonna shut down the Zoom, and we thank you for joining us. And hopefully we'll see you next week for public forum.
Thank you, Ben.
Yes.
Appreciate it. That was great.